Hi everybody, Dr. Baumholtz, and today we're going to talk about abdominoplasty, also known as tummy tuck. Well, what's a tummy tuck? So typically a patient has either lost a bunch of weight or they've had the effects of childbirth or just time and gravity and things have stretched sort of in the lower belly area. We'll start with the lower belly. All right, typically we're going to assess, meaning look at what the problem is. And the problem can either be loose skin, excess fat, loose muscles, or all three, or a combination, right? And so we have to design an operation that's going to address whatever the problem is, and if we don't, we're going to have an unhappy patient. So if the problem is loose skin, loose muscles, and excess fat, and we just do liposuction, the person's going to be unhappy because we have not addressed what the concerns are. So generally speaking, a tummy tuck will involve typically some degree of liposuction, some degree of muscle tightening or muscle plication, and then some degree of skin excision with or without the need to do something to the belly button at the same time. Typically, we will encounter, or we might encounter, an umbilical hernia or a small little hernia, especially if someone's had prior surgery, and that can usually be addressed very easily and safely at the same time of the tummy tuck. Generally speaking, it's an operation where somebody goes home the same day, and the recovery is generally 2 to 3 weeks to heal the initial set of incisions and get rid of the drains, if drains were used. And then another 3 weeks, so 6 weeks now, until we feel like our old selves again. And another 6 weeks, so 12 weeks or 3 months total, for me at least, until I want someone lifting more than 5, 10, 15 pounds. And the reason for that is, especially if we've done muscle tightening, is while you may or may not have had a hernia, when we sew the muscle together, it's like we've done a hernia repair, and it takes about 3 months for that body wall to knit together and fuse and heal so that you can then take on heavy weights. After that 3-month period, we let people go back to do whatever it is that they would like to do. Well, this is Dr. Baumholtz, and that was a brief introduction to abdominoplasty, also known as tummy tuck. I hope that was helpful. Thanks for listening.